It won't let me. Hi, everyone. Can somebody verify that you can see my screen, please? Just type me a note in the private chat. Please let me know if you can see my screen, and then I can begin. Okay, thank you, Sherish. I'm going to begin now. I want to thank Physio Club for the opportunity to chat with you today about how we as physical therapists can help our patients who are obese to feel better, to decrease their body fat, and of course, to become healthier. Okay? And hopefully we'll have lots of time at the end for you to ask me questions, okay? So just a bit about me. I'm a physiotherapist. I have been volunteering at the Aga Khan University Hospital and the Aga Khan University for about 2 years. I'm currently in Canada. I had to come back so I could get my vaccination. And I'm still doing some consulting for AKU. And thank you again to Physio Club for this opportunity. Okay, so this is my disclosure statement. I do not have any financial relationship with any entity associated with today's webinar, okay? Okay, so the learning objectives for today are fourfold. We're going to learn why it's important for Pakistani physiotherapists and healthcare professionals to actually address obesity. And we're also going to see if there's actually a relationship between physical activity and obesity. So does physical activity actually affect obesity? We'll find out about that. Thirdly, it's really difficult for patients to actually exercise, especially those that are obese. So as a physiotherapist, I'm always trying to find ways that will motivate my patients, different techniques and methodologies that will keep them interested and improve their compliance with exercise. So I'm going to review with you, based on recent research, a few novel methods of how we can address obesity using physical activity as physical therapists. And lastly, how do we know how much physical activity our patients should do? Okay, so there actually are guidelines, international guidelines that we can refer to, so I'll share those with you as well. Okay, so those are learning objectives. Okay, so the first thing I think I want to start off by chatting about is obesity is actually a real problem. And worldwide, it has nearly tripled since 1975. Now, there's many reasons why that's happened. And one of those reasons is we tend to live a more sedentary lifestyle. We drive everywhere. We don't walk as much. It's easier to eat fast food than perhaps to cook healthy meals at home. Healthy food tends to cost a lot more. And then, of course, there's genetic factors that can predispose someone to having a sedentary lifestyle. And as a result, obesity has tripled worldwide since 1975. In 2016, just a few years ago, more than 1.9 billion adults, these are folks 18 years and older, were overweight. And of these, 650 million were actually obese. And not only is obesity affecting adults, it's actually affecting children. It may be affecting your children, your nieces, your nephews, your grandchildren, perhaps. So 38 in 2019, just 2 years ago, 38 million children under the age of 5 were overweight or obese. Okay, these are 5-year-olds who already are falling into a very poor lifestyle. And then if we look at older children, those between 5 and 19 years of age, in 2016, over 340 million of these children, ages 55 to 19, were overweight or obese. And what's really scary is that the prevalence of overweight and obesity among children and adolescents 5 years to 19 years, it's actually increased dramatically from just 4% in 1975 to over 18% in 2016. That's actually a dramatic increase. I remember when I was in school many years ago, we had physical activity as part of our curriculum. So we actually had one period almost every day where we went to the gymnasium and we actually did exercise. And I remember at lunchtime, we would also be in the schoolyard, again, playing games, playing on the obstacle courses, so getting more activity. And then, of course, there were a lot of after-school activities, and we typically played sports after school as well. And right now, what I'm finding, especially with my nieces and nephew, is that the amount of time that they spend in school engaging in physical activity is decreasing. There's more and more focus on academics, and that's okay, but there needs to be a balance. So I think one of the reasons why we see this dramatic increase in childhood and adolescent obesity, again, there's many reasons, but one, I think, important reason is just an overall decrease in physical activity throughout their schooling. Okay, now why is this relevant to low and middle income countries like Pakistan? Why should you as physiotherapists in Pakistan care about obesity? Well, the truth of the matter is that initially, obesity was thought to only affect individuals in high-income countries, such as Canada, the U.S., and different countries in Europe. But there's actually an increase in the amount of people and children that are overweight and obese in low and middle income countries such as Pakistan, particularly in urban settings. And a really big urban setting is Karachi, right? Karachi, Islamabad, Lahore, those are urban settings where we're seeing an increase in childhood and adult obesity. So in Africa, which is a low and middle income continent with low and middle income countries, the number of overweight children under 5 has increased by nearly 24% since 2000, okay? And almost half of the children under age 5 who are overweight or obese in 2009 lived in Asia. Looking specifically at Pakistan, Asif et al. Did a study in 2020. They looked at the prevalence and socio-demographic factors of overweight and obesity among Pakistani adults, and they found that 22.8%, so just under a quarter of the participants were actually overweight, and 5.1% were actually obese. So out of 100, 5 were obese. And they found that women, ever married individuals and individuals living in urban areas such as busy cities like Lahore, Islamabad, Karachi, were more likely to become overweight or obese than their counterparts. So again, we're looking at the lifestyle changes that we absorb or that we adopt when we live in an urban environment such as Karachi or Lahore or Islamabad, where we drive or take rickshaw or transportation versus walking, maybe because of street crime. So already our physical activity level is low. Plus, there's less farming activity. There's less physical activity overall. It's very easy to get ready-made food on the street. Maybe it's not the healthiest. So again, the lifestyle choices that we make have an impact on whether we're at risk for obesity or not. Okay, but the important message here is that obesity is preventable. We can actually completely prevent this, or almost completely prevent obesity from even existing. So how do we do that? Okay, one of the best ways to do that is by physical activity. And as a physiotherapist, we have the knowledge and the skill to actually work with physicians and specialists to help patients become healthier. Okay, so let's review some of the evidence-based research that proves that physical activity is one of the most effective ways in which to fight obesity. So is there actually a link between physical activity and obesity? So this study by Clevin et al., it was done very recently, last year in 2020, and they looked at the association between physical activity or exercise and incident obesity, coronary heart disease, diabetes, and high blood pressure in adults. And this was a systematic review of longitudinal studies that were published after 2012, so very recent work. And they found that higher levels of physical activity, so people who generally engaged in more exercise, more physical activity, that was associated with a lower risk of becoming obese, as well as developing a lower risk of developing coronary heart disease and diabetes. This is very promising, right? And the key point I want to make here is that there are hundreds of studies that have told us over the past 30, 40 years that physical activity is positive for obesity, and it actually decreases the risk for many other NCDs or non-communicable diseases like diabetes, high blood pressure, and coronary heart disease. So this particular systematic review basically is in agreement and replicates and strengthens the conclusions from earlier reviews. So again, there appears to be a relationship between physical activity and obesity, and higher levels of physical activity are associated with a lower risk of people becoming obese. This study only pertains to adults, okay? How are we doing? So far, so good? Okay, if there's any issues with my voice quality or with the slides, please make the comments in the chat boxes, because I check those periodically. If you have any questions, you can also jot that down in the chat box, and I'll answer as we go along, okay? Okay, so let's go to the next study. The next study, oops, I think I missed one. Here we go. Okay, so this particular study was done by Chavez Guevara et al. Again last year in 2020, so very recent. And this was a really cool study. It looked at a technique called FatMax training, and they looked at the effect of this protocol, this FatMax protocol, FatMax training protocol, on body weight, on fat mass, and on cardiorespiratory fitness in people who are obese. This was a meta-analysis of randomized clinical trials, okay? And what they found was that exercise training done at maximal fat oxidation intensity at short and medium term, so at 8 weeks to 20 weeks, actually reduced body weight and body fat. It improved cardiovascular fitness in individuals that are obese. Now, why this is important is because I think some of us may have some preset notions or perceptions about what an obese person or an obese patient can and cannot do. Okay, if an obese patient walks into your clinic, that could be overwhelming, right? And what this study shows is that it doesn't matter how obese you are. If their heart is stable, then they're safe to exercise, and we can push them, okay? To the point where they're actually training at maximal fat oxidation intensity, okay? That's a really high intensity of exercise, all right? So I really am trying to push the point of view that just because somebody is obese and we think that they may not be able to do exercise, that isn't necessarily true. Give them a chance, give them a challenge, and most obese people can do much more physical activity than we necessarily think that they can, okay? So this study I included because it shatters a myth. It shatters a myth about how we look at obese people, obese patients. They can actually do much more than we think they can, okay? All right, let's look at the next study. I'm just checking your comments here. Everything seems to be going well. Okay, let's continue. So this next one, recently there's been a lot of hype about the keto diet, the low carb diet. So again, this is a very recent study. This was actually published in 2021. And these investigators looked at the effect of combining exercise with a low carbohydrate ketogenic diet. And what they found was, so again, this was a systematic review and a meta-analysis. So a synthesis of literature. What they found was that if obese individuals exercised while they were on a low carbohydrate ketogenic diet, they actually experienced a decrease in waist circumference and triglycerides. Okay, so they actually did blood work to determine the effects of the treatment protocols on triglycerides. So exercising while engaging in a low carb ketogenic diet resulted in decreased waist circumference and reduced triglycerides. This is actually a critical study because we know that abdominal fat, abdominal adipose tissue is extremely risky, right? It increases the risk of heart disease, of diabetes tremendously. So this was a really good result where there was actually a decrease in waist circumference and triglycerides. Now, generally, what I would recommend based on this study is for somebody to benefit from exercise while on a low-carb ketogenic diet. They need to actually exercise at a moderate to vigorous intensity level. They need to do it at least 4 times a week for 9.2 weeks, okay? Now, how do you know that your patient is exercising at a moderate to vigorous intensity? So that's based on percentage of heart rate max, right? So you calculate their max heart rate, which is 220 minus the patient's age, okay? And then for vigorous intensity, you multiply that number, 220 minus age, you multiply that by, say, 85%. And that'll give you the target heart rate that that patient needs to maintain while they're exercising to ensure that they're exercising at a vigorous intensity. For moderate, I would use 220 minus their age, multiply by 75%. If this person has been very sedentary and they really haven't done any kind of physical activity for a long time, I'd be a bit more cautious. I would start on the lower end of moderate, maybe at 65 or 70% of max heart rate, and then increase gradually, okay? Let's look at one more study here. So, the longer I've been a physiotherapist, the stronger my advocacy for strength training or resistance training has become for all types of processes, whether it's recovery from an injury or post-surgically, whether it's preventative physiotherapy in preparation for surgery or ACL reconstruction, whether it's for a 70-year-old who has osteoarthritis in the spine or in the knees. I always prescribe resistance training to my patients because it is one of the best rehab tools that we as physical therapists have. So there was a systematic review that was done by Orange et al. Again last year, 2020, and they looked at the effects of resistance training on the physical function of adults who are overweight or obese. And what they found in the systematic review was that resistance training has a large positive effect on muscle strength and a moderate effect on physical function in adults who are overweight or obese. What does this mean? Okay, this means that when an obese patient comes into your OPD, don't just put them on a treadmill or on a stationary bike. You can do that. You can put them on a treadmill or on a stationary bike, but then you should also try to add some resistance training to their program. Okay, whether it's doing squats or exercises with kettlebells or free weights or TheraBands, resistance training should become a critical part of any weight loss program. Okay. Okay. Now, you may have heard of high intensity interval training. It's become extremely popular over the last 2 to 3 years, especially in North America. When I was in Karachi, I met with several personal trainers. I went to several gyms before COVID, and it was high intensity interval training was just beginning to emerge in Karachi amongst the personal training community. So this is a really cool study. Again, it was a systematic review and meta-analysis of controlled studies. This was done by Martin Smith et al., and they published last year in 2020. And they looked at whether or not high-intensity interval training actually has an effect on cardiorespiratory fitness, so heart and lung health, in individuals that are healthy, overweight, and obese adolescents. And what they found was really cool. They found that in adolescents, Okay, so these are kids that are teenagers, basically, right? High intensity interval training was effective and actually improved heart and lung function, regardless of whether the adolescent was obese, overweight, or healthy. Okay, so everybody benefited from this particular training protocol. Secondly, prolonged high volume, high intensity interval training programs are similarly effective to short term, low volume, high intensity interval training programs. Okay. And the reason why I included this study is because this type of protocol would work really, really well in a school curriculum. Okay. It's quick, it's very compact, and it can be done in a group setting. So you would need one instructor, and you could have 15 to 20 kids following this one instructor. I found it really interesting to be able to try to apply this type of high intensity interval training into daily exercise when kids attend school as an adjunct to their physical education lessons. Okay. I think we just okay. So this is the last research study. So this was another systematic review looking at whether or not there's a relationship between physical activity and weight loss. And this was again published quite recently in 2020. And they actually found a dose-response relationship. What that means is if people engaged in online physical activity interventions, these people actually lost weight, and their compliance improved. Okay, and what the study found was that by incorporating gamification features, so by making the online physical activity fun, by offering incentives, the participants or the patients were more compliant, and that was one reason why they actually experienced improvements in weight. So, when I do some telerehabilitation right now in Toronto. I do, it's called virtual physiotherapy. So I've got a few patients who want to lose some weight because they're at risk for diabetes and coronary artery disease. So I've actually got them on an online physical activity program, and I'm using the Wii console to keep them engaged in physical activity. So online physical activity programs, I think, are a novel idea. Okay, I know that virtual physiotherapy is its infancy in Pakistan, but it offers tremendous advantages. And if we can make exercise interesting in an online platform, then it's cheaper for the patient. It's far more convenient for the patient. It can also be convenient for the therapist, and it can effectively decrease weight. Okay. Now, I love, this is one of my favorite slides, and I like to share this slide because it shows how physical activity affects different risks for various diseases. Okay, so not only are we actually decreasing the risk of obesity, okay, or helping people to lose weight and become healthier, but by doing so, we're actually helping them live longer. Okay, physical activity is associated with 30% lower all-cause mortality. 30% lower all-cause mortality. That's significant. Okay, even walking for 10 minutes at a brisk pace every day can increase your lifespan. It can increase how long our patients live. and it can increase lifespan by 15%, regardless of what level of physical activity you begin with, whether you're obese or whether you're fit, okay? And I mean, this is self-explanatory. Not only will it help people lose weight, but while they engage in exercise and physical activity, their risk of depression and dementia is lower, their risk of colon cancer is lower, their risk of falling, especially for older adults, grandparents, is lower. The risk of incident osteoarthritis falls. The risk of cardiovascular disease falls. The risk of breast cancer falls. And the risk of metabolic syndrome and type 2 diabetes falls. Okay, so this is one of the ways that I try to empower and encourage my patients to be compliant with exercise, particularly those that are obese and who want to become healthier. Okay, so I just wanted to share this with you. Obesity is such a problem that the WHO actually came up with a global action plan on physical activity from 2018 to 2030. And the goal here is to encourage countries to come up with policies that increase physical activity globally, okay? That's how much of a problem obesity is. So if you want to do a bit more reading, then you can access, this resource. Secondly, the WHO recently published, the WHO, World Health Organization, recently published guidelines on physical activity and sedentary behavior. These are evidence-based guidelines, okay? And these are the guidelines that I use when I'm working with adolescents, adults, or older adults who are obese and who want to become healthier. And we're going to review these in a moment. But if you want the full document, this is the website where you can get it. And lastly, the WHO also recently published the Commission on Ending Childhood Obesity. And what they look at here is how to increase physical activity, how to improve sleep for these children, and how to decrease sedentary behavior. And this document can be found at this link here. Okay, so let's look at recommendations. As a physiotherapist, this is what you need to do to help your adult patients that are between 18 and 64 years of age lose weight and become healthier, okay? They have to do at least 150 to 300 minutes of moderate intensity aerobic physical activity, okay? This means running or walking on a treadmill, riding a stationary bike, using a rowing ergometer, or doing other functional activities such as brisk walking, dancing, that sort of thing, okay? They can do it at moderate intensity. If they want to work at vigorous intensity, it's only 75 to 150 minutes, okay? So 150 to 300 minutes moderate intensity, or 75 to 150 minutes vigorous intensity in total throughout the week, okay? So I usually have my patients initially work at a moderate intensity. So if I have a 55-year-old father who is an accountant and he's obese, I would start him off at 30 minutes, 5 times a week, doing moderate intensity exercise, whether that's going up and down stairs at his home, or using a rowing machine, or a stationary bike, or a stepper at a gym, okay? Now, aerobic activity isn't enough. You must combine that with strengthening. So for your adult patients who are 18 to 64 years of age, they have to do at least 2 days of muscle strengthening activities, again at moderate or greater intensity, okay? And the types of exercises that you want to pick should include multiple muscle groups, okay? So some of my favorite ones are these elevated push-ups, okay? Because they activate the core, they activate the shoulder girdle complex, and the lower and the leg muscles as well. So you want to pick exercises that target multiple muscle groups. Another one that I love to do is a wall sit or squats. Again, squats, you're forced to activate your glutes, your quads. There's a balance component that activates the lower leg muscles. The core is activated as well. And then if you squat with your arms out in front of you or out to the side with weights, then you're actually incorporating further muscle groups in the shoulder girdle area. Okay, what if you have a patient who's obese, who's over 65 years? What do you need to do? So again, they have to engage in moderate intensity aerobic physical activity, 150 to 300 minutes a week, or 75 to 150 minutes vigorous, intense aerobic physical activity. Now, to be cautious, if I have a 72-year-old female who comes in and she's obese and her doctor has said she's medically cleared, she can engage in physiotherapy and exercise, just as a precautionary measure, I would start her off at the moderate intensity level and then graduate her to the vigorous intensity level, okay? You want them to have a positive experience, okay? You want their first few sessions of physical activity and physio and exercise to be positive. You want them to achieve their goals. So don't make it too hard for them, okay? I would start them off at moderate intensity, 30 minutes, 5 times a week, and then shift them over gradually to vigorous intensity exercise. And again, you also have to add in at least 2 days of muscle strengthening. Again, moderate or greater intensity involving major muscle groups. So I mentioned the squats, one of my favorite ones. I usually get them to hold weights or wear a backpack, okay? And that increases the use of all the major muscle groups. So I like doing assisted push-ups, standing alternate hip flexion with weights, so incorporating alternate hip flexion with alternate arm lifts, okay? So you're using multiple major muscle groups, deep squats with either a backpack with additional weight or weights in the hands. So again, you're activating the shoulder girdle musculature, the core musculature, the gluteal musculature, and the lower extremity musculature. It's also more efficient. You can target multiple muscles with only 2 or 3 exercises instead of giving your patient 8 or 9 exercises, which can be overwhelming, okay? What if you have a teenager, 15-year-old boy comes in and he's obese, his parents are worried about his health, he's got some asthma, but the doctor says it's okay for him to do activity. So children between 5 and 17 years should do at least 60 minutes a day, 1 hour of moderate to vigorous intensity physical activity. It needs to be aerobic activity, so riding a bike, running, using a rowing machine, riding any kind of gadget outdoors. They need to be physically active at a vigorous intensity, moderate to vigorous intensity for up to an hour, okay? Plus, on at least 3 days of the week, they need to do strengthening exercises. And these strengthening exercises need to have an effect on muscles and bone. So they need to be impact type activities, skipping, playing different sports, jumping drills, impact type activities that can affect bone growth and bone density. Okay, so we're almost at an hour. I want to make sure that we have time for questions. So I just want to review with you the learning objectives, okay? So our first learning objective was, why should we even bother talking about obesity? And the reason is because it's an actual problem in low and middle income countries. In Pakistan, in 2020, the study found that 22.8% of participants were overweight and 5.1% were obese, okay? Our second objective was to determine if there's a relationship between obesity and physical activity. I think it's safe to say, based on current research, that yes, indeed, there is a relationship. And generally, increasing levels of physical activity mean decreased risk of obesity, okay? Or increasing level of physical activity result in decreased body weight, all right? And third objective was, are there interesting and novel ways that we can actually address obesity using physical activity, right? The answer is yes. And the reason why this is important is because, if an obese patient comes to your OPD and you talk to them and you put them on the treadmill for half an hour, that's really boring for that person, okay? I doubt very much if they're going to keep coming back to your OPD or to your clinic because it's not interesting for them. It's boring. Walking on a treadmill for 30 minutes, 5 times a week is boring. So what I wanted to show you was that there are different types of physical activity protocols that you can give to your patient to make their exercise much more interesting, much more challenging. You can offer variety in the exercises. You can combine in-person or face-to-face sessions with some online sessions as well. And so these novel and new methods, whether it's high-intensity interval training or online virtual sessions or a combination of those, give us more options that we can share with our patients to help them become healthier as they begin to lose weight. And lastly, are there prescription guidelines for physical activity? Yes, they are. We just reviewed those. They can be found at the WHO website. Okay? Okay. If you have any questions for me that we don't get to, please feel free to email me. This is my email address here. And you can also find me on Twitter, Facebook, and Instagram. And I often post videos, exercise videos, tips and tricks for physiotherapists. So you can follow me on those social media platforms for that information. Okay? I'm going to stop sharing my screen, and hopefully now we can have a chance at asking some questions. Do you as physiotherapists have patients who are obese who come to your OPD or to your clinics? Thank you, Michal Wahid, and Faizan Hamid Panhwer. My apologies if I'm mispronouncing your name. Thank you also, Mariam Kamar and Haider Jani, Raviha Nisar. It's nice to see everybody here. Shafkat Faraz. Thank you for your positive comments, everyone. So feel free to comment in the chat about, yes, okay, Sweet Lover has said, how to manage obesity with arthritis patients. Okay, so this is a really good question. So I'm gonna assume that you mean osteoarthritis, which is affecting the patient's back or hips or knees. Okay, so what you can do is start with non-weight bearing exercises first. Okay, if this person has osteoarthritis, they're probably over 60, over 65. So there's actually no research that says exercise affects cartilage. It actually affects cartilage in a positive way. Okay, but to ensure that you don't scare your patient, I would start in an open kinetic chain, or I would start in a non-weight bearing position. So I personally would like to, I typically start with the patient on a bicycle, a recumbent bike, where they can sit back, their back is supported. I keep the bike at a fairly low tension, and I adjust the seat so they can get a full range of motion, okay? And as their tolerance improves, you increase the resistance. So you can do cardiovascular exercise or aerobic intensity exercise at a moderate intensity initially on this bike, and then gradually increase the resistance to a higher intensity, okay? Once they become confident that they can do this exercise, even though they have arthritis and they're obese, once they become confident with that, then I would begin to add in the weight-bearing exercises, okay? You can do short squats, where they're only squatting 30 or 40 degrees. You can do walking while they're holding a weight in their hands, okay? So you're incorporating weight-bearing exercise, which will actually benefit the cartilage in the knees, okay? So begin in a non-weight-bearing position and then graduate to weight-bearing. This is how I would handle an obese patient who has osteoarthritis. Another question here is how to manage obesity after pregnancy. Excellent question. So at AKUA, I actually designed a postnatal rehab program. And what I would recommend is most women in Pakistan have a C-section, unfortunately, okay? So we have to wait until the stitches are actually removed. That usually happens 10 days after the C-section, okay? So once the stitches are removed, they can begin physical activity. Even before the stitches come out, they can begin isometric abdominal strengthening, okay? So they can start isometric abdominal strengthening. Once the stitches come out, they can come to your OPD or to your clinic, or they can do an online session with you, a teleclinic, and you can guide them on walking and doing different exercises in weight-bearing position. If they are healthy and they have medical clearance from their OBGYN, there's no reason why they can't engage in a weight loss program with you, okay? So I would get them on a treadmill, on a stationary bike, if they're coming to your OPD, on a rowing machine. I would combine those exercises with core stability and strength training right away, okay? So doing squats, doing incline push-ups, so not a flat push-up, but the type where, you know, the hands are on an elevated surface, okay? They can do things like bicep curls, overhead press, chest press, different types of exercises. So I would begin with isometric abdominal strengthening. Once the stitches are removed, typically 10 days post C-section, I would begin again at moderate intensity. So moderate intensity of heart rate max, and then increasing gradually, combining cardiovascular aerobic activity with strengthening, okay? And so that's how I would manage obesity post childbirth. Okay, there's a question here. From Rama Khan, why obesity is increasing in children as their physical activity level is much more than adults? So, hi Rama, really good question. So although their physical activity level may be more than adults, it's not enough, okay? Based on evidence, based on research and the WHO guidelines, kids 5 to 17, 18 have to do at least an hour of moderate to high intense physical activity, an hour a day, every day. And then 3 times a week, they have to do strengthening, whole body strengthening, involving multiple muscle groups. impact type activities to help with bone development as well. So think of all the kids that you know. If you have nieces or nephews, or if you have grandkids, cousins, how much time do they spend in front of the TV? How much time do they spend on their phones or on their iPads or on their devices? How much time do they spend playing video games? Now, with the pandemic, there's a lot more online learning as well. So they're not getting out as much. So there's multiple reasons why children are becoming obese. Their activity level might be more than adults, but it's not enough. They spend far too much time on their electronic devices. And they just don't get enough physical activity. And also, what I've observed in the schooling system, I mean, I'm not sure about the schooling system in Pakistan, but I know in Canada, there's less and less time spent on physical activity and more time spent on academics. And that's okay. But then it's up to parents to find a way to incorporate physical activity into the children's lives, whether it's doing physical activity as a family together or enrolling their children in sports programs after school. Okay? So I hope I've answered that question. Okay, Health Updates asked a question. Are guidelines same for obese cardiac surgery patients like CABG? No. Okay? Obese patients following CABG need to engage in something called cardiac rehab. Okay? It's a very strict protocol, and usually each hospital has their own protocol. All right? So Health Updates, I'm not sure where you're based, but if you're based in Pakistan, and if you're affiliated, if your patient has CABG at Aga Khan University Hospital, then the physiotherapy outpatient department at AKUH has a protocol that they follow for any cardiac surgery patient, obese or not, okay? So I would recommend that they engage in cardiac rehab. And then once they've finished cardiac rehab, which can take up to 3 to 6 months, depending on the protocol, okay? And depending on the type of surgery they've had, once they have medical clearance, again, from their cardiologist or cardiac surgeon, if they still want to lose more weight and become healthier, then they can be transitioned to a physical activity program with a physiotherapist. But initially, obese post-surgical cardiac patients need to engage in cardiac rehab, okay? Very strict protocol. Okay, Sweet Lover says, thanks for answering, but in weight-bearing patient complaint due to pain in joints. Good point. Initially, you start non-weight bearing, okay? Once the flexibility of the knee and hip joints improves, once they've lost a little bit of weight, remember, even losing 5 pounds has a huge impact on how much weight is impacting the hip and knee joints. So I would not start weight bearing an obese patient with OA right away. Give them a chance to improve their flexibility, their mobility, their strength, and to gain a bit of weight loss, and then I would transition them. And it's okay for them to complain of pain. A little bit of discomfort is okay. It will not do any damage. It'll actually, the weight-bearing activity will actually benefit them in the long run. So you have to be able to counsel them, encourage them, and reassure them, okay? Amina Iqbal, hello ma'am. As physical activity is an important part of life, I would say to remain healthy, you can please explain some easy exercises that people can easily do at their homes for beginners. Okay, I'm going to try to demonstrate some very generic and easy to do exercises, and hopefully you can see what I'm doing. So one of my favorite exercises are push-ups, okay? And what I normally would recommend is using a surface. So I'm using my desk here. Okay, this is my desk, okay? And what I'm gonna do is, instead of doing the push-up on the floor, which a lot of people might not be able to do, I'm going to use the desk. And I'm just gonna do my push-up in this manner, okay? The advantage here is that you can do this virtually anywhere. As you get stronger, you lower the surface that you're doing the push-up on with your hands until you're on the ground. Okay? Another really good exercise to do for overall strengthening is a squat. Why is a squat good? It's good because it targets the glutes and all the major muscles of the lower extremities. Okay? And you want to have your feet about shoulder width apart. Okay? I would have the arms out and you squat down. Hold that for a couple seconds and then back up again. Okay? Squat down, hold that for a couple seconds and back up again. When this becomes easier, what you can do is you can add weights. You can add a backpack, okay, with weights to your back, or you can hold some weights in your arms by your side as you do the squat. Okay, another good one to do is a lunge. All right, so again, this is for dynamic stability. It's really great for core stability, abdominal strength, and for lower extremity exercise and strengthening. And again, you can have weights in your hands, and you're basically just lunging down. Okay, and you can do this repeatedly. All right, so those are a few exercises that you can do at home, that you can give to your patients to do at home. Another good one that I recommend, if people live in an apartment building, they have access to stairs, many flights of stairs. So, they should wear a mask because of COVID, but they can run up and down the stairs. If they can't run up and down, they can actually just take the stairs. But what they need to do is go at a brisk pace, all right? Up and down maybe 5 flights or 6 flights. So the reason why I like doing stairs is because it's a great way, again, to activate the glutes and all the big muscles in the legs. If the patient can have really good posture, then it also is activating the parathoracic and lumbar musculature, as well as the core musculature. So going up and down flights of stairs is a great way to incorporate regular physical activity into a patient's life. Okay. Health updates, yes, I'm in Pakistan. So depending on the hospital where the patient is getting the cabbage, that particular hospital's OPD physio department will have a specific protocol for the patient to follow. Okay, any other questions? I'm so happy with everybody's attendance and the quality of the questions that you guys asked was wonderful. So I really want to thank you for your interest and for all the physiotherapists out there. The value of physiotherapy in Pakistan is underappreciated. Okay, and we have so much to offer you. Pakistani physiotherapists have so much to offer. And I want to encourage you to have the confidence to communicate with physicians and with medical specialists, to share your expertise, to share your opinion during rounds. Because it's important for these people, these other health professionals, to realize the knowledge that you as physiotherapists have. Okay? There's a lot of areas in which we can contribute as physiotherapists, and helping a patient who's obese become healthier is one area. All right. So I don't think there's any more questions. I'm wondering if our host can come back or what they want me to do next. Thanks, Mariam and Haider Jani. I appreciate your positive comments. Have any of you worked with obese patients? Could you make a comment in the chat to let me know? Hey, Alina. So squats. Okay. So I would recommend that you go to fatigue. Okay. So you tell your patient to keep squatting until they can't squat anymore. Okay. The more the better. Because remember, we want them to be doing this at a moderate intensity level. So they need to do a lot of these squats. 20 or 30 won't be enough. They need to do a lot. So you want to push them to the point of fatigue. Okay. Miriam, ma'am, how can we manage obesity in diabetic patient? No change, Miriam. You follow the guidelines. Okay, their diabetes, you need to make sure that they don't have diabetic neuropathy, because that puts them at risk for falling. And if you're going to be doing a lot of exercise with them, then you want to make sure that it's safe for them to do standing weight-bearing exercise. So make sure that you assess them to exclude diabetic neuropathy and a history of falls. Okay. If they have diabetic neuropathy and a history of falls, I would start them in a non-weight-bearing position on a rowing machine, a rowing ergometer, okay, or on a stationary bike, or recumbent stationary bike, again, where their back is supported. Then once they improve in that, then I would progress them to weight-bearing exercises. If they don't have diabetic neuropathy and their balance is good, I would combine the two right away. Okay, I would start them on cardiovascular conditioning exercises, like the stationary bike, rowing machine, doing stairs, walking on a treadmill, and in combination with that, I would do weight-bearing exercise right away. All right. So that's how I would handle obesity in a diabetic patient. And you know what the beauty is that as they lose weight, over time, the amount of insulin they need to manage their diabetes will also decrease. And it's important for you as a physiotherapist to track that. So you have to communicate with their endocrinologist, okay? Because they're going to be getting blood tests done every 3 or 4 months or every 6 months to manage their diabetes, right? So what you can do is get those results. And after 3 months of your program, you can see the change in the blood test results. And you can use this to show the endocrinologist how effective your treatment is, but also you can use that data to prove to the patient that their hard work is paying off. They may not see it, okay? They might not see that their diabetes is improving, right? How do you see if your diabetes is improving? You can't. The only way is by looking at blood tests, right? So you can use that improvement to show the patient that their hard work is paying off, and this will give them encouragement, and it'll help with their compliance. It'll want them to remain consistent with their physical activity. So again, Amina, how many sets of squats? As many as possible, okay? The more, the better. The patient should go to the point of fatigue, okay? But you want to give them maybe 3 different exercises, each to the point of fatigue. So they can do one upper body exercise like the push-up, and then one lower body exercise could be the squats. Miriam, with diabetes, if there's no neuropathy, no risk of falling, be aggressive, do a lot of weight-bearing strengthening, as well as cardiovascular conditioning, okay? If they do have neuropathy, then I would start a non-weight-bearing position and graduate them to a weight-bearing position. Any other questions? Okay, Amina, diabetic foot. Then you have to, so again, you can begin in non-weight bearing, right? You can do a cycle, you can do rowing machine, you can do a lot of strengthening as well in a non-weight bearing position. or a modified weight-bearing position, like a squat, where you're actually pushing the plate away as opposed to standing, okay? And I would actually ensure that the diabetic foot is stable. So you'd want to consult with an endocrinologist or a foot specialist to ensure that it's safe for the patient to begin aggressive strengthening in a weight-bearing position. There are special braces, orthotics that can be prescribed and that can be designed for the patient to help accommodate a diabetic foot, because we don't want to cause uneven distribution of force or impact leading to skin breakdown, which is a huge risk with diabetic foot. So you can begin in a non-weight-bearing position, Amina, but once the patient is ready to be progressed, you want to make sure that they have proper footwear, dispersing weight as equally as possible before you begin them on a weight-bearing program, okay? But there's no reason why they can't do non-weight-bearing strengthening and non-weight-bearing aerobic exercise, all right? I'm really happy with the questions you're asking, because this means that you're thinking about how to actually do this with your patients. That's wonderful. And you know, I've met some amazing, amazing physios in Pakistan. So don't be shy. Share your knowledge with your patients. Share your knowledge with your medical colleagues in the hospital, in private clinics, so that they understand the value that you can bring to collaborative patient care. Miriam has a question. Ma'am, I'm not sure if my question is right or not, but if there's a renal failure in diabetic patient, can we manage it with physical therapy? Yeah, absolutely. With renal failure, you know, they need dialysis, right? There's a lot of evidence that shows that while patients are having dialysis, they can engage in physical activity. And what we do here in Canada is when a patient is in dialysis, we actually get them to ride a bicycle, but they're seated, they're sitting, and they're riding a bicycle with their legs to engage in aerobic and cardiovascular activity. And it actually, this type of physical activity actually has multiple benefits, multiple health benefits for overall kidney function, for the immune system, and also for mitigating the risks from having a sedentary lifestyle due to the need for dialysis, because they typically need to come in at least 3 times a week for several hours, right? So people on dialysis and with renal failure tend to be much more sedentary, right? So getting them to be active is even more important. So there's no reason why somebody who has renal failure undergoing dialysis, okay, can't engage in physical activity. We should encourage them to do so, actually, okay? Raviha, Nisar, thank you so much. I'm really glad that you found the webinar great. That's awesome. I've got a few more minutes and then I have to go to another webinar that I'm doing. My next webinar with another group is on Achilles tendinopathy. So check my Facebook page. I've got the link there, and you can join that one as well. For those of you who are interested in Achilles tendinopathy, that's a much more sports injury perspective. It'll be a much more technical webinar, but I think you'll find it useful. Rabia, thank you so much for the opportunity. It's been a pleasure, and we can do another one in a few weeks, okay? I'm going to sign off now because I have to prepare for my next webinar, all right? Thank you, everybody, for joining, and good luck with your patients, and stay safe with COVID. Get your vaccine and keep wearing your mask. Allah Hafiz.